Namaste. Today we will discuss regarding the cause, the symptoms, and the first aid as well as treatment of acute gastroenteritis. Acute gastroenteritis is a common illness which is encountered in summer months. There are many reasons for it. In summer, there is rise of temperature and it accelerates the degradation of proteins in food, as well as it creates a favorable environment for growth of bacteria. The real cause of this gastroenteritis is mostly bacterial, but there are various virus and fungus which are the causative agents for some of the gastroenteritis. But per se, you can say in large number of cases, bacillary dysenteries are of bacterial in origin. So what are the signs and symptoms? First, loose motion, pain abdomen, vomiting and cramps in abdomen, and a sense of weakness due to severe dehydration, and the symptoms are further worsened by rapid loss of fluid and electrolyte, which results in cramps in peripheral part of our body like upper and lower limbs. So in case of severe dehydration, there is loss of water, which leads to fall of blood pressure and other vital parameters. So in case of gastroenteritis, the major signs are due to dehydration. So the dehydration is manifested by less quantity of urine output, dark colored, painful urination, and pain associated with passing of urine. Also, in many of the cases, due to exotoxins and endotoxins secreted by the bacteria, there is onset of fever. Very high grade of fever can also seen in case of acute gastroenteritis. So, what are those diagnostic approach? First, the sign and symptoms and history are the main guide to diagnose acute bacillary dysentery. There must be history of outside food intake, particularly pre-cooked food left for more than 6 hours, 6 to 8 hours, and non-vegetarian food, spicy food, oily food, food of doubtful sources which are cooked outside and transported to in another site and consumed in other site also. So the main reason is growth of bacteria and release of toxins in the food. Some of the bacillary dysenteries are due to endotoxins already secreted by the bacteria, and some of the bacteria are found in live form in certain foods. In summer, particularly due to outdoor activities and tourism activities are more due to summer vacation, so people take outside food very often. Due to extreme heat in evening times, there are huge number of person taking outside snacks and food. This is the major reason, and the history itself guides about the diagnosis. Second, sign and symptoms. The loose motion and frequent passage of stool with tenesmus, that is painful abdominal cramps, are the common symptoms. Sometimes fever also occur. Vomiting, fever with rigor and chill are associated symptoms. Signs are mainly due to uh, toxemia in blood due to formation of toxins and release of toxin in blood by the causative organisms. The most common organisms responsible for this bacillus dysentery are Shigella, Salmonella, and other Campylobacters, jejuni, and some forms of Salmonella species, Proteus also, Pseudomonas, Proteus. These are main causative organisms. But in certain areas, due to fecal contamination and fecal-oral route entry, Escherichia coli is found to be the most common bacteria responsible for bacterial gastroenteritis. So, regarding to the investigation, the stool routine and microscopic examination is being carried out, and presence of pus cell signifies the presence of bacterial contamination, and presence of mucus with red blood cells further raise the suspicion of presence of bacteria. The specific diagnosis takes place by taking the rectal swab and by sending the swab for culture and sensitivity. After identification of the bacteria, specific treatment are prescribed. Before the culture report, presumptive antibiotics and other symptomatic treatments are being carried out. Coming to the prevention part, first, always in particularly summer month when the infections are most common, the outside food consumption should be discouraged and freshly cooked food are preferred, and particularly the protein rich food and fatty foods which are mostly degraded and it is more favorable for growth of bacterial agents. So taking of outside food should be discouraged, and the food should be consumed immediately after cooking, because after sometimes there is degradation and fermentation of food materials, which also invites bacteria for growth. And third thing, if such symptoms occur, immediately the medical advice should be taken, and the dehydration part should be taken care of by giving ORS, and dehydration must be prevented by using home available fluids like rice water, soup, and any other drinks which are available in household environment. So these are some common precautionary measures we can take to prevent bacillus dysentery. If fever is there, then paracetamol 6 hourly to 8 hourly must be given to control the fever. And for resistant cases which are not responding to common medicines, must be referred to higher center for proper diagnosis and management. Thank you.